To the Ministry of Health, this is our presentation on Laos. Presenting this project will be Stephanie, Vanessa, Juliana, Delaney, Kathleen, and Ariana. We hope you enjoy.
Briefly describe the burden of disease in your country.
The global burden of disease can be determined by disabilities adjusted life years, also known as DALYs. To represent both mortality and morbidity, DALYs are calculated by years of life lost and years of life lost to disability. For the Lao People's Democratic Republic, DALYs lost per 1,000 population for non-communicable diseases is 112.5. For group conditions per 1,000 population, it is 243.4. For injuries per 1,000 population, it is 47.2. In total, for all causes in Laos, the DALYs lost per 1,000 population is 403.1. It is estimated that the environmental burden of disease is 26% of all burden of diseases.
Mention the top causes of death among both adults and child population.
The main cause of mortality and morbidity in Laos are communicable diseases. The main cause of death for children under the age of 5 is pneumonia, but other leading causes are diarrhea and respiratory problems. The most common diseases causing death to people in Laos are diarrhea, dengue, acute respiratory infections, parasitic diseases, and vaccine-preventable diseases.
What are the 3 main public health issues that your group suggests to address?
Our first public health issue is the high prevalence of nutritional deficiencies. In addition, poor sanitation is another health concern in Laos that has affected the occurrence of several infectious diseases. Our third key public health issue is the continuous spread of HIV/AIDS. Lack of funding towards healthcare seems to be the common factor affecting our 3 main public health issues for this struggling country. Per 100,000 people, 1,336 people are affected by nutritional deficiencies. This is a problem that can be easily solved by simple adjustments in the diet of the people of Laos. With little funding, many people in Laos can get the nutrients they need for a healthy diet. The most common causes of nutritional deficiencies are lack of protein and vitamins. This is an issue that should be prioritized because death is likely to result from a malnourished human being. Poor sanitation is a growing problem in this country and can lead to numerous infectious diseases. Common diseases include meningitis, hepatitis, dengue, and typhoid fever. Both hepatitis and typhoid fever are caused by consumption of food or water contaminated by fecal matter. Meningitis is a bacterium transmitted from person to person through poor living conditions and unsanitary environments. Dengue is a mosquito-borne viral disease linked to urban environments and again is associated with unsanitary environments suitable for diseases to manifest in insects. This should be a major focus when dealing with healthcare issues because everyone deserves to be able to have access to clean resources. By eradicating this issue, the people of Laos could limit the spread of infectious disease amongst the population. The more people that realize how serious HIV/AIDS is, the more people will strive to educate themselves further regarding matter. This issue is prioritized because unlike most diseases, HIV/AIDS is incurable, so the only way of fixing this problem would be to prevent it from happening altogether. Although antiretroviral treatments are extremely costly, more funding should be delegated to prevent these health issues from becoming overwhelmingly hard to control.
What are the relevant risk factors contributing to these 3 health issues?
Factors that are contributing to the continued prevalence of nutritional deficiencies is the geographical condition in Laos. The lack of available land and poverty is restricting their agricultural process. Lack of education has also led Laotians to miss out on important feeding practices. For poor sanitation, more than half of the population lives in upland areas where there is a critical lack of infrastructure, which presents challenges to sanitation service delivery. Another factor is the lack of safe drinking water. Many villages use untreated water for cleaning, drinking, cooking, and washing. Many regions around Laos have an increase in infection rate over the years. The increase of HIV in Laos can be contributed to the increase of mobilization and migration between Laos and its neighboring countries. The lack of use of condoms is another reason for the increase in HIV.
Recommendations for immediate intervention. The recommendations that we can provide are building water wells, condom dispensaries, and providing education on the relevant risk factors in Laos. What are the vulnerable population groups to be targeted?
Pregnant and lactating women, children, those living in the upland areas, sex workers, injecting drug users, and men who have sex with men.